Keir Starmer signing an international pandemic treaty giving the World Health Organization the power to recommend lockdowns during future outbreaks. Now, this agreement, backed by dozens of other countries, aims to improve global coordination. Yeah, because the WHO did really well, didn't they, at the last one, with plans for better disease surveillance and sharing of vaccines and medicines. Or maybe we'd like the WHO just to literally point the finger sometimes at where this thing started, rather than shaking hands and going, you did really well there. Yeah. I'm talking China, of course. Critics warn it gives the WHO too much sway over UK decisions, even though the treaty doesn't allow it to enforce any measures. Will Jones, editor of the Daily Sceptic, is with us afternoon to you, Will, and it's on that point, really. I mean, I think it'd be fair to say the WHO have got form in, shall we say, disappointing us during a pandemic.
Yeah, certainly. The World Health Organization really did itself no favours during COVID-19. It was fanatical about lockdowns from the get-go. It sent a delegation infamously to Wuhan in February 2020, just as things were getting going, when only China had locked down, looked at Wuhan's lockdown, came back singing the praises of China's response and recommending that lockdown, that appalling reaction to the virus, over the top, extreme reaction done in that totalitarian country, and recommending it to the whole world as the correct and proper response to this new virus. And it only got worse from there. And so we see this continued fanaticism about lockdowns. Then it recommended masks, famously changed its opinion on that as the public opinion changed with no new scientific evidence, completely altered, and started telling everyone to wear masks. And then, of course, it brought in the recommendations for rushed experimental vaccines with the mandates for those as well, and continued to recommend school closures throughout the pandemic, decimating education across the world and with lasting implications that we're continuing to live with. So we have a lockdown fanatical World Health Organization. Now we have this new treaty that's been signed by the UK, by Starmer, yet again signing away the UK sovereignty to this international body that is now being empowered to recommend lockdowns and all of these things that we thought and hoped that we were not going to see again from COVID, seeing them institutionalized and put onto this international treaty footing in this new pandemic treaty.
Has it been watered down from what was originally intended? When I first heard about this, and this, as you will know, Will, goes back a couple of years now, where they were talking about the WHO having the authority to instruct lockdowns. Was that just a sort of an internet rumour, or was that how the story began? Certainly at the moment, the status is they can recommend a lockdown, but is that a compromised version of what they actually wanted?
Definitely. This, as you say, this treaty started way back during the pandemic. It's been brewing for years, until last year. Until this time last year, the proposal for the draft for the treaty specifically said that the World Health Organization, the Director General, will be able to make binding instructions about public health responses in the countries across the world, that countries would, under international law, because it's an international treaty, that they would be obliged to follow and implement. And although, of course, international law is international law, and so countries can, in theory, ignore it because it's not their domestic law, in practice, though, of course, our governments, especially the UK government, is surrounded and filled with lawyers, international lawyers, Keir Starmer himself, a human rights lawyer, who are fixated on following every dot and tittle of the international law. So we could be pretty sure, or we can be confident, that this would have been followed. However, that was watered down at the behest of many countries who were not at all happy with this language. The World Health Organization insisted that even at the time, that this didn't give it the authority to impose lockdowns internationally, although that was clearly the plain meaning of the language, as everyone could see. The new Trump administration, of course, pulled out of the World Health Organization, partly over concerns about precisely this treaty and the World Health Organization's attitude to pandemics and lockdowns. So it was watered down, and so now what we have, instead of this binding instructions from the Director General, we now have recommendations only. However, it's certainly, lockdown is written throughout the throughout the treaty, not the exact words, but what we do see is that we see that the definition of a pandemic, and this is reflected also in the parallel international health regulations, which go hand in hand with this, the definition of a pandemic now includes that a pandemic necessarily includes by definition a whole of society and whole of government approach to responding to the virus. Now that, of course, whole of society, whole of government, that is exactly what we saw in the pandemic. That's no accident, and that is code for lockdowns and everything that we saw during COVID, and that's now written into the definition of a pandemic which the Director General of the World Health Organization has the sole discretion to call, and more than that, to call not just when there's a disease that's actually causing illness and hospitalizations and death, but just when he thinks that there is a risk, just a risk of one in his sole discretion and opinion. So we now have really, and that's all written into this treaty, into the international health regulations that go with it. So we've really seen a ramping up of the powers of the World Health Organization, the Director General, to call a pandemic, and for that pandemic to have these lockdowns and so-called whole of society measures written into the response.
There's a wider question here as well about these kind of global international bodies, Will. The United Nations is one of them. And such a lazy reference point, isn't it, when somebody in an argument will go, oh yeah, but the United Nations said, as if it's the kind of Oracle of Delphi, as if this is, an unarguable point to go to in any argument. You just cite the United Nations and somehow you are automatically correct. And people do the same with the WHO, and I'm sure when somebody first came up with the World Health Organization back in, I think it was 66 or whatever it was, when it began, they were referencing things like the Spanish flu when 30 million people died, and doesn't it make sense to have an international response? And on paper you could say, well, there is clearly international cooperation. That works. But what seems to happen with these big global institutions, and I'm just talking about the two famous ones here, but particularly the WHO, is that this curious, pervasive and utterly destructive notion called groupthink gets a real life of its own. It becomes a very lazy reference point for politicians. Well, the WHO said so. As if this is some sort of greater spiritual and intellectual authority over our own jurisdiction or over our own medical minds or political decisions. It's a go-to place. People do it all over the place. We do it with individuals where we cite them. Paula Vennell's running the post office. Forgive me for going on a bit here, Will, but there is some relevance. Was cited for her whole career as this person of utter... Nobody actually stopped to say, is she any good? And, of course, the answer was no. She was pretty rubbish, hence the reason why we ended up in this mess. And similarly, here's the analogy with the WHO and the like. I'm sure there's some great people there, but the idea that we just defer to them and indeed hand over to them is it's anti-intellectual, it's bonkers, and it's dangerous.
Yeah, absolutely. And it's completely naive as well. We have to remember the World Health Organization is not some neutral body that sits above our governments, filled with neutral, impartial experts. It's beholden to the interests of its member states, such as China, massive state, but also increasingly to public-private partnerships, particularly with billionaires with their own particular interests in what they wanted to do, who give a lot of funding for those things. And what we have to remember is that the World Health Organization wasn't originally set up specifically to address pandemics. That's become the obsession in the last 10 or 20 years. And it was set up to do the basics, sanitation, basic medicines, the things that really save lives across the developing world. And the real danger, as Dr. David Bell, who is a former World Health Organization scientist and medic himself, has pointed out constantly, the real danger is that those key interventions that really make the difference in poorer countries are being swept aside by the obsessions of richer countries and billionaires and China to address these so-called pandemics, which have not caused significant mortality in the scheme of things compared to high mortality diseases such as TB and malaria, etc. And since the Spanish flu, really. And so we have these, and so now we have this obsession with pandemics. The World Health Organization even referring to times not when we're not in a pandemic as interpandemic periods, as though pandemics are the norm, and what we're living in is not normal times.
So when there's no pandemic, that's abnormal, and we should treat it as such. And then when the pandemics come around, that's what we should expect and how we should expect to live. There's a sort of a God complex, isn't there, that goes with these jobs. And, you know, like any big institution, I'm sorry to rattle on about this, but they do, you know, they have ambitions, and their ambitions is to grow. They always want to grow. Well, you'd think in an ideal world, the WHO's ambition would be to get smaller because everything gets better. But they're, you know, if they can stick another floor on that building in Geneva, they will do. I bet there's planning permission gone in already with the Genevan authorities for that, you know, because that's how they work. That's how these institutions operate.
Yeah, that's the internal logic of any international or any national bureaucracy is always just to increase its own power and influence and the pay and sphere of influence of its employees. That's just human nature, and we see that with these bodies that float above democratic accountability and above governments. It's that on steroids, and we certainly see that with the World Health Organization. Absolutely, the United States is exactly right to have pulled out of it, I would say, and Robert F. Kennedy Jr. was calling on other countries to join the US and other countries who he says are like-minded with them to do something different and to look for a better way, and a way that isn't obsessed with pandemics and with lockdowns.
Yeah. Well, with 7,000 staff and £7 billion a year to spend, you've got to do something with your time, I suppose, over there at the WHO. And this is their latest initiative. Listen, Will, thank you as ever. Will Jones, editor of the Daily Sceptic.